putting up clean water now signs on the sand in Imperial Beach. And I asked him, what is that? What are you doing? And he told me, don't you know you surf the most polluted beach in America? And I had been surfing for 2-3 years at beach without knowing. I never even had seen the signs. So I got involved with his organization called Wild Coast, and I began as a volunteer, and I worked my way up to Coastal and Marine Director, and all the time working on both sides of the border, working with Mexico at the municipal, state, and federal levels, working here at the federal, at the state, at the county level, to push for solutions. So I want to ask a question. How many of you have heard about this crisis? Okay. Now, how many of you truly understand what the crisis is about? Yeah. Okay. So we're going to get into it. I'm going to give you a pretty broad overview of why this crisis exists, what we're doing about it, and how you can play an essential role in us helping the most affected people by this crisis. That sound good? Yeah. Okay. I say all the time, this is the biggest public health and environmental emergency in the Western Hemisphere, and that is not hyperbole at all. This truly is the biggest environmental and public health crisis that most people don't know about, outside of here, outside of the county. And I'm going to explain why. So it all begins with the shared nature of the Tijuana River watershed. You'll see it here delineated in green. 3/4 of it are in Mexico, 1/4 is in the US. It's about 1,800 square miles in size. And the river captures water, flows in and out of the border, flows south to north. And in the area in red, that's the Tijuana River Valley through which it flows and discharges into the Pacific Ocean just south of Imperial Beach. So why is there a crisis? Well, to begin with, the watershed, because it's shared in nature, it flows through the city of Tijuana. The city of Tijuana is on average 300 feet above sea level. And it's approximately 2.5 million people that live there. And not everybody has access to infrastructure, that being trash collection services, waste tire collection services, or sewage infrastructure. And in Tijuana, what they have is a combined stormwater and sewage system. So every time it rains, all of that rainfall comes down, washes down the hillsides, comes across the border into the river, and then, as I showed you, into the ocean. And because it's stormwater and sewage infrastructure that's combined, there's a big pressure on the sewage infrastructure because of the stormwater, the rainwater, and you have a lot of breaks and a lot of collapses, and that's when we have constant sewage spills happening. So there is infrastructure in place that was achieved through a binational agreement signed back in the 40s. And then in the 90s, there was the first ever binational wastewater treatment plant, which you'll see in the middle where it says 35 MGD. That's a plant that's located in San Isidro on our side of the border, but it's treating 100% of sewage from Mexico. It goes in an underground pipeline and discharges 3 miles offshore, which most treatment plants in the United States do so because of the Clean Water Act regulations. And then in the lower left side of the graph here, you'll see the San Antonio de los Buenos treatment plant, or Punta Bandera. You might have heard about it in the news. This plant has been outdated, dilapidated for 15 years, was not treated with wastewater whatsoever, and was discharging between 25 and 35 million gallons of just untreated wastewater into the ocean. So what would happen is all of those flows would come, especially during the summer months when we have south swells, they would flow the currents south to north, and we would have impacts all the way up to Coronado from those flows. Excuse me. So just to give you an idea of what we're talking about here, over 100 billion gallons of sewage have come across the border, either through the Tijuana River Valley, which is the river itself, or through this outdated sewage treatment plant that's discharging constantly south of the border. And for the longest time, we thought this was a coastal access issue. We thought, okay, well, us surfers, we can't go surfing, we can't go swimming. It's sad, but that's about the extent of the crisis here. And you probably have heard on the news as well how we've had our beaches closed. This number is already outdated. It's over 1,300 consecutive days in the southern portion of Imperial Beach, and now it's impacting us all the way to the Hotel Del. Somebody sent me photos yesterday of the signs were up at the Hotel Del, and that's starting to become a more consistent situation. But what is most important here that I want to talk to you about is not so much the coastal pollution. Yes, that impacts us because of the churning of the waves and all of that. But now, thanks to the very robust work from a number of different scientists, including scientists from UC Riverside, UT Austin, UC San Diego, and San Diego State University, specifically two researchers, Dr. Kim Prather from UCSD and Dr. Paula Granados from SDSU, we have now honed into one of the primary problem areas, which is what we call the Saturn Boulevard hotspot, and I'm going to explain a little bit more about that. You'll see on the bottom right of the slide there's a box, and you'll see some white that looks like snow, but that's not snow. That's foam that's visible from space, from satellite imagery. You can see this foam from space. Who here thinks that foam is normal in a body of water? So you'll see two pipelines of the four that currently exist at Saturn Boulevard that were placed to prevent flooding in the Tijuana River Valley. The Tijuana River Valley is prone to flooding when it rains. Ironically, we now know that they are exacerbating the issue because of these culverts. There's a maybe 6-foot drop off, and then there's riprap or rocks, you'll see them there at the bottom of the slide, that are causing increased turbulence of the river. And it's causing the water to churn, and that churning is what's generating and shooting out into the atmosphere molecules and aerosols of this toxic soup. And I'll get into that in a second. Just want to show you something I didn't mention, but I think it's very important for you guys to know is river systems in Southern California should not flow year-round. They just don't. Our rivers flow when there's rain. This river is now flowing year-round because it is concentrated residential and industrial waste. It's not rainwater. It's not, stormwater. It's all waste. And we have this on a year-round basis. This video is really cool. It was taken by Dr. Granado's brother-in-law. The situation last year got so toxic that all the scientists that were embedded in the community had to be pulled out because the hydrogen sulfide gas levels were so high. So we called in this specialized team, the firefighter drone squad, to collect samples with drones so that the scientists and the students, there was a bunch of master's and PhD students, could go in there and take samples without exposing themselves to all of this. So that's just to give you a little bit of an idea. So hydrogen sulfide, this is a toxic gas that probably most of you in this room have smelled one time or another. It smells like rotten eggs, right? In 2024, you'll see during the month of September, we had some very concerning, very high levels of hydrogen sulfide, especially at nighttime. As you can see in the slide, they peaked at about 4,500 parts per billion. Now, I'm going to go ahead just a little bit here because I want to touch on this. At the bottom of the graph here, you'll see a dotted line. That's the California standard for air quality, air ambient quality. So that means that 30 parts per billion, which is the dotted line, is pretty much the standard for when you can detect the gas and where you may be able to be exposed to it for an amount of time without risking falling ill. The other standard that exists is the standard for OSHA standard for wastewater treatment workers. That standard is a little bit higher because they're working with wastewater, right? They have to sometimes be exposed to higher levels. They have to be wearing PPE and certain, measures that they need to take. When they're exposed at that higher standard, they have to wait 24 hours before they're exposed again. So those standards are much more lenient because they're for workers. The standards that we have for just community exposure are the dotted line. So as you can see, those have been exceeded, not just during those days, but several days at a time. So here you'll see the number of hours per day that the people in the impacted communities have been exposed to. There was the 8th of September there of last year where we were exposed to hydrogen sulfide levels well above the standard for almost 20 hours in one day. That is extremely concerning because it is not just hydrogen sulfide that we are being exposed to. That is the gas that we can detect. There is an array of other gases that you cannot perceive that potentially could be even more toxic. And those are just the toxic gases. Now I like to count myself in the cohort of scientists, but I'm not. They have collected a broad array of different types of constituents like heavy metals, volatile and organic and inorganic compounds. Well, those are basically chemicals that can be carcinogenic. Not to mention the pathogens that can be found in these molecules like bacteria, parasites, and viruses. Particularly concerning is norovirus. Yeah, so here it is. They also found antibiotic-resistant bacteria, as I mentioned, 392 plus chemical contaminants. Some chemicals that are even banned in the United States have been found in the water samples. Obviously, the air is extremely concerning, and the soil samples, as you can see, a number of different really bad things. And I'm going to go back here because I want to emphasize how important it is for us to address the hotspot. The circle in red is about 1.5 mile radius. We have at least 11 schools that are within that distance from the hotspot. We have Mar Vista, Southwest High School, Berry Elementary, Nestor Language Academy, Mendoza Elementary, Central Elementary. These are all kids that, as you know, as physicians, are at the age where they need all the oxygen they can get at the molecular level so they can develop in a healthy way, right? And when you have these gases in the air that they're breathing on a consistent basis, that could have very, very concerning impacts in their development, whether it's physical or even mental and psychological. So it's extremely concerning what we've been finding. I already talked about this. Now, What the scientists found also is that the emissions are strongest at night when the winds are calm, and especially when we've had heat waves. The boundary layer compresses colder down, and gases tend to be heavier, so they're compressed closer to the ground as hot air rises. So that's when we've had these periods of, we call them odor events. We know that if we're smelling rotten eggs, we're being exposed to a multitude of other potentially concerning contaminants. So now we understand that the path for exposure to people is not just through, oh, if you swim and you ingest water, you could get sick. It's also through breathing in and through your skin. As Dr. Prather constantly says, we humans breathe in 11,000 liters of oxygen, of air per day. So the coastal impacts, or the potential impacts from entering the coast, are the least of our worries. That's why we are so focused on this potential project that I'll go into right now and how we can remove the hotspot. But also what we need is more data. There's been a couple of studies that have been done. It was because of our advocacy. I think when I was mayor of the city of Imperial Beach, 1 year alone, I went 3 times to DC, met 3 times, 2 times with the White House, and on my 3rd visit, I went to the Centers for Disease Control begging for help. So they finally sent a team, assembled a team in partnership with the county at the time to conduct two studies. One was the ACE study. There's a pretty significant sample size. It was 2,100 survey respondents. They found that at least 92% of the respondents did not feel safe in the areas where they live, where they work, where they go to school. Think about that. That's a super high number. 64% reported new or worsening physical symptoms. Something that was surprising was that 28% reported symptoms of anxiety. 21% reported symptoms of depression. There were some that even reported being suicidal. And 65% of participants feel their mental health symptoms are related to the sewage crisis. So remember when I said this is the biggest public health crisis in the Western Hemisphere? This is what we're talking about. This is the data that people are reporting, and this is what we're hearing, which confirms what us as elected officials in South Bay have been hearing for years now from our community. Our community has been telling us desperately. I've been hearing from moms telling me, and this was like 5-6 years ago, telling me that when the beaches were closed, her little girl would go into these violent episodes of vomiting and diarrhea overnight. Or another father that lives in Imperial Beach, has 6 kids, would tell me how their kids, like, they would go out on vacation, they'd come back and they'd be just ridden with, allergies and asthma and coughs. So what these surveys found is consistent with what our communities have been telling us for quite some time. Now, this was the other health study that was done, the Community Assessment for Public Health Emergency Response, or CASPR. Very consistent with the other study, pretty much the same numbers around what they're feeling, how they're being impacted in their quality of life. And then, as you all know, the 2025 Community Health Needs Assessment is also aligns itself with what the need we're seeing with these two CDC reports are. Help with environmental and public health crisis. This is what the community is reporting they need. They need better data collection and coordination when we see crises such as this. Managing mental health issues and asthma and allergies and all the other symptoms. And we need to have interventions so that we have less of a burden on the emergency departments. So what role do we play in this? There's a very real opportunity here, and this is my call to action to all of you, to help us better understand. Now we have the 2-3 studies that have been done, the self-reporting studies that have been done, but now we need to collect hard data. We need to be able to share data so that we at the county can work with our experts to better understand, to better characterize the health impacts of this pollution. It obviously helps in our efforts to continue sounding the alarms. You've heard me probably over and over sounding the alarm. We need a state of emergency, a call to our governor, a call to our president. With more data, we'll be able to make our case even stronger, that we need real medical interventions, and we'll have that data available to show the need. So what we're asking folks is to share, maybe even ask your patient, a qualifying question. Have you been down in South Bay? Something as simple as that could really start helping us connect the dots. At the county, we have initiated efforts to conduct an epidemiological study. Thankfully, the entire Board of Supervisors, we've approved unanimously beginning that effort in partnership with our Chief Medical Officer at the county, who's here. You want to wait? Thank you. To better understand how we can have medical interventions. So, just to reiterate, we have the empirical evidence that the scientists have collected, soil, water, air data. Now we have the pretty robust self-reported data from the CDC with the ACE study and the CASPER study telling us how people in the South Bay are being impacted and to what degree. So now what we need is that data so that we can help inform an epidemiological study. So I will end there and give everyone an opportunity for questions. Thank you.
This is really more curiosity. First of all, I didn't know half of that, so it's amazing. Is there a plan or solution if there was funding of what would resolve the crisis?
Yes, that's a great question. I didn't really go into that because that's a whole different discussion. So you probably have heard in the news that there were $600 million secured from our congressional delegation to expand and double the capacity of the International Wastewater Treatment Plant that I referred to earlier. That's on its way. With the Trump administration, they've expedited those efforts. That's great. Now, we also talked about the sewage treatment plant south of the border. Through Mexico's president, past President AMLO and the current president, they've expedited completely replacing that treatment plant. So it went from functioning at 0 to now 18 million gallons per day. That's been completed. That's a promise they committed to us. They've done it. What people don't know is that neither of the two plants are treating what's flowing through the river. And that's the entire cause of what I just went over right now. So ideally, what we would want to see is the river be diverted and treated so that we can begin to see relief for South Bay families. That's going to be a very heavy lift because there's many who believe that it should be, and I'm not saying it shouldn't be Mexico. Mexico should be doing a lot more, and let's just be very clear about that. But we've been waiting for a long time for Mexico to, do more. And there's challenges there, and there's reasons why they haven't and all of that. But at the end of the day, we have a crisis on our hands. So something that the county will do that I committed since day one when I first began my campaign for this office was we can at least remove the hotspot. That hotspot that I showed you is within our hands. It's within our jurisdiction. It's an infrastructure fix. We've, through Prop 4, which was passed in 2024 by the voters in California, there's been $50 million earmarked for the Tijuana River. And we've been going to Sacramento and advocating for those funds to come down. In the meantime, the county is taking on the responsibility of creating a feasibility study on what that infrastructure fix looks like and how much it'll cost. And in the meantime, we're securing the funds so that we can at least remove those pipelines, remove that riprap, and that'll begin to mitigate at least the emissions of aerosols into our environment and hopefully mitigate what people are breathing in. But the real solution is eliminating the flow in the rivers. And we're going to continue working with Mexico to see if there's a solution for them to eliminate them upstream. But if not, we need to take the bull by the horns and have that fix on our side. And whether we send the bill later, at least we're protecting our families, which are tens of thousands of families that are being impacted by this crisis, which is way worse than what we saw in Flint, Michigan, and Palestine, Ohio, when we had that derailed train and emitting methane gases. So thank you for that question.
Thank you very much. So you might ask, why the Tijuana River? Why this conversation? One, always appreciative of a supervisor like Supervisor Aguirre, who's very passionate about an issue. But for those who paid attention to our 2025 needs assessment, it was also a top priority identified by the community.